Okay. Hello, everyone, and welcome to the Health Innovation Playground. This is Yusuf, and it may be your first time seeing me because this is our first video episode. I'm so excited for it. And today I have a new co host, Gigi. She's a product consultant and she's been working in the healthcare field as well. And we're so happy to welcome a very dear friend and our guest, Aline Noizet. How are you?
Very good. Very happy to be here.
I'm so excited to have you today. Like it's my pleasure. And would you introduce us? Tell us a little bit about yourself. Tell the guests about you.
Sure. So I'm Aline Noizet. I define myself as a digital health connector because that's what I do. I connect the actors of the digital health ecosystem, and I've been doing that for 15 years, mainly with a focus on startups. So helping startups to connect with the rest of the ecosystem, work on their strategy, look for funding, etc. Because I really believe that innovation coming from the small companies can really have an impact, especially on patient and healthcare professionals.
And what it feels, what it means to be a connector, or what motivates you to do that.
So I think that's something that I have inside of me. I think I define it as a gift. So I manage to understand what the different people want and to connect and say, hey, you should talk to that person because of this. You should talk to that person because of that. So I think my mind works like automatically. I know which connection should happen for an impact
Mm,
to be real.
mhm. And you've been doing this in Barcelona, and what a place to be. What brought you to Barcelona, and what's the story? You said 15 years ago?
So I came here to do my MBA at ESADE. And me starting in digital health was random. I always say like, healthcare find me. I didn't find healthcare. So there was an event at ESADE where startups came to meet the MBA students, and they were looking, yeah, for students for the summer internship. And I was talking French with my friends from the class, and someone came and said, "Hey, she speaks French." And they were actually looking for a French person to open the French market. And I said yes, and I studied with them, and I was love at first sight from day one,
Mm.
and I've been in that space for 15 years. So a very very nice story.
That's awesome. I love to hear how the French connection took you that far. Just a little segue into our next question here. We were wondering, since you've been a witness to this ecosystem for such a long time, really very much since the beginning, I wonder if you could comment on how it has evolved over the years. What are the major changes that you've seen being in this space for such a long time?
So I would say that I started in digital health when digital health was started mostly. So I remember the very beginning. That's where the first Fitbit and Jawbone came on the market, and they were only counting steps. So you can imagine, like, everybody was excited about that. We were started talking about data that could be collected, that could be used in the hospital. But it was very, very early. And I saw all of that evolve. Like when you think of Fitbit, where they are today, Apple Watch, Aura, like just we're completely different world, like so many data being collected. So yeah, a lot has happened along those years.
It must have felt disruptive back then. And did you think people believed this was going to happen? Or people were skeptical whether digital health is going to succeed or not?
I would say people were skeptical mainly because the issue at the time, I remember when we were at those conferences, Health 2.0 conferences that I was organizing, and we were showcasing all those companies. There was really the startups on one side and the hospital on another side, and we needed to bridge that gap.
Mhm.
And for the startups, it was, where do I find a contact in the hospital? Who do I talk to? And for the hospital, so what's digital health like? So it took some time actually to mix the two. And today we have like lots of pilot. We talk about pilot, it is right, but like digital health solution is more implemented in the hospitals, and it's more like health today. We like
Mm.
that's digital part is becoming just everyday and normal.
Yeah.
And what do you think helped make health tech so mainstream these days?
I think the but the time, like we were missing validation, trust as well. People and healthcare professionals needed to see those solutions in action. They needed to interact with the solution in the everyday. I think that's what's scary, what happened. Like, I know for many startups, they were trying to push their solutions to the market, to the doctors, but they were quite reluctant. But with time, they can actually see outcomes, results. They can play and use the solution and see the impact for themselves and for their patients as well. So I think it's time really helped.
And the idea of health startups, always health was being moved by big companies, pharma, medical device companies. When did it start to change that actually small startups, one or two people sitting together, are bringing solutions in health? And how did this happen?
But so for me, it's all about collaborations, not the startups on their own, but they're really collaborating more and more with pharma, with hospitals. So it's like a teamwork, no? And I would say I also feel that it's kind of when I arrive in that space that startups were becoming more prominent, and we saw more cases. I remember for the pharma, for instance, Bayer was the first pharma company to launch an accelerator and to really collaborate with startups, and that was 2013, the first edition in Berlin. So for me, it's like more about at that time, because that really helped as well to have a pharma supporting startups. There was a stamp like, yeah, they've been collaborating with Bayer. So it was easier for the startups to actually go and work with hospitals after that, or to look for funding as well.
Mm-hmm. Mm-hmm.
Right. And I'm wondering from your experience, really, working so closely with founders as teams as well, what actually you think makes a good founder? What makes or break a good founder?
So I would say it is someone who has the vision, like a clear vision, a clear roadmap on what needs to happen. They can also put together like the right complementary people to make that reality happen. And for me also, that's something also very, very key, is the culture. Someone who is able to really create a culture where people feel well, they feel like recognized, where the like error is fine, where that CEO is creating a leaders. It's not about ego, it's really about empowering people and growing all together to have impact
Mm-hmm.
as a team.
Mm-hmm. Wow. And for founders coming outside of medicine, who are not doctors, who didn't work in the healthcare system before, maybe engineers or business people, how would you explain the healthcare system for them? How does it differ from other sectors?
So I don't have that much experience with other sector either than truck. I was working in truck before. But maybe for me, the main difference is that healthcare is very regulated,
Uh-huh.
because we have patients in the middle. So you have to make sure that your solution is certified. You have to decide if it has to be certified, which type of certification, and it's very slow. And maybe that's something that outsiders don't realize, like how much time it takes to bring a solution to the market, to have like ethical committee approved like a pilot in a hospital. So yeah, for me those are the main and also I guess the fact that there's a patient in the center makes things like extra careful. Like you can't just do something. Like security is priority, because the patient is at risk possibly, so that also adds another layer in that industry.
Right. And going a little bit deeper into this, um, obviously you mentioned there is aspects like such as regulation, security, and so on specific to the healthcare industry. And I'm wondering if you could expand a little bit more as to what is it that fundamentally differs when somebody is going into founding, into an entrepreneurship journey in healthcare versus any other industry.
So for me, the main difference, what I found recurring in digital health or in healthcare, is to start from an unmet need. So really to identify an issue. And this you can find either it's from like your patient, or you have someone in your family, and it comes from a lived experience and you build something around that, or it's like talking to a hospital, a pharma company, and understanding their needs. And for me, the most successful companies, there was a real unmet need at the beginning. And for me, that was the main difference. When I was working in track industry, that's not exactly something that was as relevant as in healthcare.
You kind of create the need and bring, yeah.
Exactly.
Yeah.
Yeah.
So we're talking about digital health, and this term is being used a lot today, and maybe some people can't get their head around it. And so, what does it actually mean? Like a definition that encompasses everything it's about.
Yeah, that's a good question because I think we have digital health, health tech, med tech, and it's confusing. Like even for me, sometimes I have to check with people what they mean. But it's also a good question for me because I have to explain my family what I do, and that's also the question. Like, what do you do? I'm like, yeah, I work in digital health, so I say it's new technologies applied to healthcare. And then I give them example because otherwise it's still that's not very clear. So I say it could be an app that can help a patient that has diabetes, for instance, so they can manage their day to day. Or it can be a solution that can help healthcare professionals to diagnose a disease better, for instance.
Mm-hmm.
So really trying to use example and it's clearer for people.
Mm-hmm.
Right. Yeah. Now, going a little bit more into the definition, just thinking a little bit about the full life cycle of a healthcare product. If you were to expand a little bit around it and think about, starting from being built by a clinician, being built around the patient needs and so on, how do you see that full life cycle? What's there that we should really keep in mind?
Okay. So that's actually another very good question because we talked about that last week. I was doing a workshop with the guys from Pharmacy, and that our workshop was based on the pain points from the different actors of the ecosystem. So we discussed that innovation journey, and the four of us were like, okay, but what's the innovation journey? And our conclusion is that there's not exactly one because we can all disagree a bit, but I'll give you like my version, what I think the simpler version that we kind of agreed on. So first you've got to identify the unmet needs, what I said before. And for me, that's key. You're really to start from something. What are you going to solve? Like who is affected by that problem? It's so very important. And then you get to the ideation and validation of that solution. Is there a need? Like, will people gonna use and pay for that solution? Because your business after all, so that part is very important. Then you're gonna prototype your solution. And then that's when you get into clinical validation. And that includes also the regulatory. And that's like heavy part. You need to decide what do you need for regulatory to make it happen. And that's long and it costs money. And then you go to the implementation. So that's when you can go in a hospital and make it live for healthcare professionals and for patients. And after that, you can think about reimbursement. So to have your solution reimbursed. Um, I think, especially in Spain, it's easier with private insurance companies. And then your idea is to go to the national public insurance because then you can reach like more people. And then the final phase or like the next phase will be like scaling up. So scaling up in the country and also outside in different countries around the world.
Mm-hmm. And which of these stations you think is the most complicated or people are not prepared for?
So it's actually what we discussed last week in that workshop. So I can share a bit of feedback from that. But one is really the unmet need, to identify the unmet need. And for startups, so if you come with your own solution, something that you have experienced yourself, that's fine because you know it. But if you want to help a hospital, for instance, it's not always easy to know what they are working on or looking for. So we're missing a bit of communication between the two. And then the thing that's complicated for startups is the funding, to look for funding at different phases. And the investors are more and more demanding. They want more and more KPI, they want traction, they want sales already. And then regulatory is another big one because it takes time, it costs money, and you really and also especially in Europe. So we are in Europe, but there's like 27 different healthcare systems, and each country can have their own regulation on top of the European regulation. They're adding new revolution on the European level, like the AI Act, and that actually like adds for the startups in terms of work and in terms of cost as well. So I would say those are the main, and maybe also would add the adoption. So once you have a prototype, you validated your solution, you manage to do pilot. So we talk about the pilot it is. You go from pilot to pilot, but then you can't find the buyer, the hospital that will actually pay for your solution. So that's another big hurdle in that journey.
Definitely quite a number of obstacles to navigate over there, but a very exciting field nonetheless. I wonder, what kind of shifts can we forecast at this point in time, or what's your personal take on it?
Um, I think we're gonna see more and more care at home.
Mm.
And that's the big thing for me. We've seen it that already, and think for two things, because the hospitals are becoming like very busy, and that concept of hospital at home, where you are switching everything that you can at home, and the hospital will remain just the four walls where operations need to happen, like what needs to happen there will happen there, and the rest can move at home. So that's a big thing. And then I think there's also mentalities are changing, and patients are becoming more empowered, and they have more tools to manage their health at home, so they can just order things at home. And so I think those two things are going in parallel, and for me that will be the major shift.
Wow.
Positive outlook.
Yeah, so like we imagine like hospitals in the future are managing their patients from their homes, and I also imagine medical devices set up at homes, like detecting if an elderly fall, detects activity of the patient at home and monitors it, and it's all connected to the hospital, right?
It is, yeah, but it's not the future, it's already happening today.
Wow.
Yeah, like here in Barcelona, Sanitas, they have the hospital at home already. And there's some another one in Holland, for instance. And no, it's not the future.
I think COVID has pushed to this direction a lot. Like nobody would have expected that like 5 or 6 years ago.
Definitely expedited
Yeah.
the progress,
Yes.
so to say.
Yeah, exactly. Yeah.
So talking about progress, actually, this is a good segue into the field of femtech, and also being aware that it has been systematically understudied and underfounded for such a long time, really ever since its inception. I wonder what's your take on femtech as it is nowadays?
So it's an area that I like a lot, and I'm really glad to see it growing and to see so much attention getting into femtech. And for instance, so we are just in April, right? And we already had like 4 or 5 like reports on big companies like EY, BCG on femtech, and showing how big of a market it is and the big opportunities that it represents. And I think that's what we need. And there's definitely a lot that can happen in that space, and that needs to happen. I think what we see more right now is like we're closing the gap, because as you were saying, right, like women's health has been under research, and we need to catch up, because the treatments today have been designed for men, and they are not adequate for women, and that's why so many companies are actually working on that, so we have the right data. And Aura, for instance, we're both like Aura users. They just launched the proprietary AI model for women's health, so they can actually understand better the hormonal impact on women, and they will match that with our own, like the sleep readiness circle. So I think that's a big step forward for women's health.
Wow. And you feel this entire system is changing to reflect that, or to focus on women more, or it's just treating the symptoms on the top?
No, I think it is changing. Like we see it more and more. Like more companies are active in the space. There's a big discussions always around investment. So it's true that less investment has been made in women's health, in women's founders in general. And this is, I think, we're slowly catching up as well. And something that for me is very important is also awareness. We're talking more and more about the different conditions that are affecting more prominently women. And that's very important, because like last week I had a conversation with a woman about endometriosis. Right. Sorry. So we say, yeah, men are not educated, but I was actually positively surprised to see that, well, not women are also. So I think generally it's important to talk about those conditions. So men and women, everybody understand how they're affecting women and how it is impacting the society more at large.
Right. And so, who are the people that are actually helping us this day to learn more about health tech? Who are the big people out there that are helping us not just to learn more, but are really also building the scene as we speak?
But first, as I was saying before, like the big companies, the big consultant, they are publishing those reports who are very important. We also see there's that association called Femtech Across Borders, and it's an association of a femtech local organization. There's like Femtech Spain, Femtech Germany, Femtech India. They're all across the world, and they're really raising awareness about solutions in their own countries. And then, as an association, they are spreading that across the world. So I think that's very important. And maybe also something that's important to highlight is that it's not just women building in femtech. So we also have men building solution. I think it's also important to have them in that discussion and building those different solutions.
We definitely need both to make the conversation
Exactly.
mainstream.
Exactly.
Where do you see the challenges coming in this area in fintech?
So the big one is funding. I think that's what we're talking about that all the time. And I think another one is the awareness, as we were saying before, because there's still like so many people who don't know about those different conditions, especially for women who are trying to raise money for the femtech solution. They talk to investors and they are usually not aware of the conditions, and because investors are mostly male, so that's where we need to advance a bit. I know that's where women are as struggling. And I think there's also like a mindset shift that needs to be done around women's health. Because if we talk about menopause and endometriosis, finding a solution for that condition maybe won't be like a direct, strong return on investment financially, but it will have impact, like indirect impact, but that's really huge. Like the time to diagnostic log endometriosis, it's 7 to 10 years right now. So if you can shorten that time, like that's a big impact for the people impacting by it. Menopause is another big one, and this is affecting women who are like in the workplace because absenteeism, like less productivity. So if we address that, then we're gonna reverse this. So the impact is huge, but maybe we need to look at things in a different way, not always in terms of financial return, but the outcomes that it can produce. And I think the last challenge would be monetization of those solutions. I think there's many women's health femtech solution out there, but it's not always easy to find the right business model for people to pay for it. So I know there's quite a not growing number of B2C solutions. So companies selling directly to the women, they pay out of pocket because there's a real need, there's a real pain, so they would pay for it. But Europe is not exactly a country where B2C is strong. It's stronger in the US. So we need to evolve on that so those solutions can become B2B and someone to pay for them.
Right. I like that you mentioned endometriosis already, and just thinking about any other area where we're really seeing change happening fast. Maybe some other areas within women's health that we're really trying to target and focus on. Any take on that?
So where there's a need for sure is conditions that are affected women more particularly. So the pain, the joint pain, for instance, um, cardiovascular conditions, like a heart attack for women is not the same as men, and this we don't really know. So those require the most attention. But we've also seen some improvement in early diagnostics, for instance, like more like AI solution being applied to mammogram, so we can
Yeah.
detect those conditions earlier, and that's a big thing. And maybe what I was mentioning before, those solutions will enable women to take care of themselves at home. So having you can order a test to measure your hormone level, or to do your annual checkup that you do at the gynecologist. You can do it directly at home. You will receive a tampon. You do it at home. And for women, like in terms of experience, it's
Hmm.
it's way bigger, way higher.
We're different.
Yeah, yeah.
Wow. Let's shift to another sector in health tech. Now the healthcare model is changing worldwide. So instead of traditionally treating an ill patient, we are more shifting towards taking care of the person during their health before even getting ill. And here comes a few new topics like preventive medicine and precision health. Can you tell us a little bit about that? Introduce that to our guests.
Yeah, so that's something that's been rising a lot those past years, and especially when we talk about longevity.
Mm,
Longevity is kind of a buzzword that englobes lots of things, and prevention is one of them. So to actually take better care of ourselves so we can live longer. But yeah, there are different, especially the insurance companies are looking at that more and more. And the government, that's slower. I think some are also starting to look at it. Something that makes sense, because if we look into prevention, then we're gonna decrease the cost that one person represents. That's why insurance companies are so interested in that space.
mm-hmm,
And what do you think is actually shifting right now that is making healthcare more personalized and more custom built?
I think the people have been more empowered lately. Like there was really a shift with the patient, or the consumer has really come at the center of everything. They want to be more empowered, better to take better care of their health, to be included in the decision made about their health. And that's why they have more solutions available for that. So I think good example of a prevention solution is Neko Health, that was created by the founder of Spotify, Daniel Ek. And this is a great success. Like they recently opened their new clinic in the US. So they started in Sweden, then London. Now they go to the US, and they have like, I don't know if it's 500,000 people in waiting list. And this is working very well. They made it in a way that it's actually accessible. I think it's 200 euros or pounds per year. It lasts for 1 hour, and people who go there,
and
they're
what do they do exactly? I don't know.
so they do a full body scan, some blood tests. They also have like a special machine where they look at the veins with like special lights. They look at your skin, like all sorts of things. And when you leave your appointment, you have the results already. And they're telling you if there's something wrong with you potentially, so you can make a good follow-up appointment with a specialist to look at that special condition.
Wow.
Yeah.
And what's changing in today's technologies that's enabling things like that to happen?
I think maybe the technology itself and the
Mm,
solution. So I think maybe in the case of Neko, it's more, I would say it's a mentality.
mhm,
Like people are open for that, and the price.
mhm,
Because yeah, I think guess the technology, it's a bunch of technology. I don't think that the solution used by Neko are the best. They also benefit from the brand, and who is funding the brand. But yeah, I would say people are more willing to do it, and 200 euros per year, or 300, let's say, if it's
mm.
in euros, it's quite accessible, no? Like more people can do it.
Right. I'm curious about this dualism between aspiration versus reality. It seems like solutions like Neko Health are actually delivering value, and I'm wondering, where is preventive healthcare is still a promise, where is it something that is yet to materialize? How can you comment a little bit more on this dualism?
So I think that there are things happening. Like we've seen like lots of improvement in the past years. So, for instance, here in Barcelona, Sanitas they launch a prevention service through genomic. So you do a genomic test, and based on that, then you meet with the prevention team, and they give you like a plan to take better care of yourself. So maybe here what I see, so reality it's happening, but where we are not quite there yet. So I did it. And when I got the results, I think I was very excited. Nothing wrong with me, like no, nothing like, which it's a bit scary when you do it, like, oh, what if I have like a heart condition? And but we are still like for instance, give you a concrete example, like breast cancer in my case, you're in the percentile X. So it's not exact science yet. It gives you an idea. Yeah, you don't really have the condition to have it, but I feel we are not exactly there yet. Same for the microbiome, for instance. I'm a big fan of microbiome. I did like several tests already, and I'm more into that those past month also. And that's why I feel that it's also very big for prevention. Like there's a lot happening in the body, the connection between the mind and the brain, but there's still so much that we don't know. And that's where we need the science to catch up, and that will take some time. But I feel that's where prevention could really become a more reality, where it's gonna match.
Right.
Yeah.
Exciting times ahead.
Exciting times. Like we need some optimism right now. And I would like to end with a question I usually ask all the people I sit with. How do you see the healthcare in 10 years?
So in 10 years, like the hospital at home that we were mentioning before, that will be a reality. Digital health will be health. That will be common. Like we will all be at home. We will order whatever we need to manage our health. We'll be much more in power. And I still see the healthcare professionals being here, being present, and being that human touch that will explain us and connect the dots between all what's happening for me is key. And I know what we say that AI is gonna replace healthcare professionals, but I really believe that like, human is still gonna be here, and the healthcare professionals, their role are gonna change, but towards like a more like human and empathetic
I
relationship.
think like it should be. Like I think traditionally the role of a doctor used to be more of a caregiver and a person who cures the person, not just gives them medications or does operation. Maybe in the last 100 or 200 years it has changed to that, but as it should be more holistic and more caring about the patient. So I don't think any technology could replace a human touch. Like some things won't ever change. Um,
And maybe what I'm hoping also in 10 years to have more like a functional medicine, because right now it's very siloed. Like each healthcare professionals is looking at his specialty, and you need to go and see like 5, 7 healthcare professionals to have an overview of what's happening with you. And my hope is that in 10 years, it won't be the case anymore. Like there will be like holistic approach,
yeah.
Right.
one person. Yeah.
But what I really hope for is this kind of mentality or this kind of shifts reach the medical education, because we weren't taught that in medical medicine school, and I don't think curriculums are being changed anymore. And now with AI, like all of the information are just there. You really don't need to study that much like we did, but you need to think differently, and you need to think on what could you do as a doctor that AI can't do, and be good at that, right?
Definitely, yeah. Topping that up with, coming from product and from tech, I love to see how medicine is getting closer and closer to design thinking, to user experience, user interface, all these topics that we can actually work on. A lot of joyful optimism in this channel. So I think it's just super exciting times, and I can't wait to see what's happening.
Wow. Me too. I can't wait.
Absolutely.
Thank you so much, Aline. It was such a pleasure having you today.
Thank you. I really enjoyed it.
Yeah, it was so much fun. And thank you, everyone listening. And I wait for us for the next episode in the Health Innovation Playground.
Stay tuned.
Perfect.
That was amazing, guys. I learned so much. That was very interesting. That was